Well, it seems we have a lot of specials today, so much so that we had to play the big story. But in fact, it's our Wellness Central today, and it's a special segment as well, as we would like to commemorate World Sickle Cell Day 2024. So today we join millions around the globe in raising awareness about sickle cell disease, a genetic blood disorder that affects millions of people worldwide, particularly in Africa.
Now, this day is dedicated to educating the public, supporting patients and also their families, and advocating for improved healthcare and research. We have a very special guest to shed light on the efforts being made here in Nigeria to combat this disease. Joining us via Zoom is Dr. Annette Akinsete, the National Director and CEO of Sickle Cell Foundation Nigeria. Dr. Annette, you are welcome. Thank you for joining us.
Thank you so much. Good morning, and thank you for having me. I'm glad to be here.
Welcome. Now, please, let's start by if you could tell us about the significance of World Sickle Cell Day and why it's important for us to observe this day.
Excellent. So very briefly, it was in 2008 that the United Nations actually passed a regulation, if you like, for World Sickle Cell Day, that June 19th be celebrated as World Sickle Cell Day. As you know, I'm sure you're conversant with the World AIDS Day, World Malaria Day, all those world days that are enacted by the World United Nations. So we clamored over many years, really, for a day to be set aside for the world to celebrate World Sickle Cell Day. And as you know, this is a condition that really affects mostly us in this part of the world, in the tropics. So it is not something that affects everyone equally globally. So it was not so much, if you like, an emergency or an urgent need for the rest of the world. So, but we pressed for it. And today we do have a day set aside for raising awareness locally and globally about sickle cell. And I'm glad that the Federal Ministry of Health and many subnationals, many state governments have taken it up very seriously and are really marking the day by raising awareness and carrying out other activities to rally around Nigerians to come to know more about the condition, less about the stigma, or know about the stigma and not to stigmatize or discriminate against persons who have sickle cell. There's so much to unpack around sickle cell. It's a very serious condition. Nobody says it's still in the back, but we want to be able to celebrate the people who have the condition and help them live normal, productive lives.
Yeah, indeed. And one of the challenges you just mentioned, which is quite major, is stigmatization that the people living with sickle cell disease face. But what are some, besides stigmatization, that they face? I mean, you had a foundation, I'm guessing access to healthcare?
There's so much, but you see, Sickle Cell Foundation Nigeria was established, in fact, we're 30 years this year, established 30 years ago for this purpose, because it was clear that there was a gap, that the government was doing so much, but they had to prioritize as usual. So sickle cell fell through the cracks. So Sickle Cell Foundation was established to fill that gap and establish a national center for sickle cell. And this is the first of its kind in the whole of Africa. It's here in Lagos, opposite Louth. And it was a call to the WHO's, it was a response to WHO's call that if any condition is determined to be of public health significance, that a country has to establish a center that addresses all aspects of that condition. So we at Sickle Cell Foundation Nigeria, we do everything sickle cell, from prevention to treatment, care, support, and now even cure. I mean, as you know, I think you remember that we have established a center for bone marrow transplantation, and that's a cure for sickle cell. So we do everything in the entire spectrum, as well as research and capacity building. Anything you can think about around sickle cell programming, Sickle Cell Foundation is championing and rallying all the stakeholders along to be part of the story.
It's interesting that you mentioned the cure, that's bone marrow transplant. Most people don't know about this, but however, how expensive and how accessible is this cure that you speak about?
Good question. It's expensive. That's the truth. As a public health physician, I always like to talk about what I call the pyramid of care. And the pyramid of care is the base. The base of that pyramid is where we as public health physicians like to focus. That is the most care for the most people. And when I say the most care, I mean the basic care. Persons with sickle cell need to take medication every day of their lives to keep well, and to keep alive. And that means daily paludrin to prevent malaria, or proguanil to prevent malaria, daily folic acid to be sure that the blood cells are replenished, painkillers almost every day, name it. And then now we have newer drugs that prevent crisis. So these have to be taken every day of their lives. And I tell you, these people spend out of pocket. The health insurance companies tell us that sickle cell is not good business. So they don't really take care of sickle cell patients. So leave that as it is. So it's left to us, entities like us, to go around, cap in hand if you like, to mobilize Nigerians, charitable persons and entities to put together funding so we can take care of persons who have sickle cell disorder. I think I sidetracked. There's a particular question you asked me, and I was building up to it. I don't remember now.
Well, I had asked earlier about a cure, how affordable it is, and how accessible
exactly.
it is.
That cure is not affordable. So I said that base of the pyramid is the most care for the most people, comprehensive care, so that you're treating the patients not only physically, but also mentally, emotionally, because it's everything. But the apex is where bone marrow transplantation lies. We have it in Nigeria and in our center, so that it's available and accessible to Nigerians. Quality and safe bone marrow transplantation for Nigerians locally available. But I said it's not cheap, it's expensive. Most Nigerians who access it have to go abroad, to America, to Europe, and to India. But the reason we have it here is that Nigeria is a country with the highest burden of sickle cell in the world. So if we don't have a sickle cell, a bone marrow center, who should have? So for that purpose, and to encourage Nigerians to stay back and access it here, we have a center developed. Having said that, not every patient with sickle cell is a good candidate for bone marrow transplantation. The doctors who do it are very selective. They will look at you and determine, let's weigh the pros and cons. If sickle cell is not so bad, we can manage it properly and you can live well. It's better you stay on that lane than take on the risks, because it's not a stroll in the park either to have bone marrow transplantation. It's fraught with a lot of risks. But it is also true that once it is done and done properly, like we are doing here, it is safety and quality, done and done properly to the right candidates, is like day and night or night and day. If someone who was SS becomes AA or becomes AS, depending on who the donor is. So it's imperative that we have it, but it's not for everybody and it's expensive.
Dr. Akinsete, I would like to also ask about other, recent advancements and advancement in treatments that are affordable. And when we're talking about affordable, can you give a bit of stat, like numbers on there in terms of affordability?
Let me just talk affordability. I was talking about it just on the 19th. The average person who has sickle cell disorder who takes folic acid and proguanil on a daily basis, these are the basic meds, maybe some painkillers, because they're always, like, the hallmark of disorder is pain. They spend an average of 5,000 naira a month. 5,000 naira a month is not cheap for many Nigerians. And that's when we don't add hydroxyurea. Hydroxyurea is a more expensive medication, but it prevents crisis and really improves quality of life for persons with sickle cell. If we add that, if we add blood transfusion, which it tend to be, many patients are on chronic blood transfusion, that is, they need to be transfused at least 3 times a month. If you add that, we're talking about 100,000 naira or more per month. If you add exchange blood transfusion and further admission, you're talking about sometimes 1 million naira a month. It may not be every month, but that's how much they have to bring out of their pockets to pay. So we really have to focus on patient care, patient treatment, and you mentioned affordability, but who takes care of these monies? What are the HMOs and what's the Nigerian government doing about ensuring that HMOs register persons with sickle cell and have them on board and manage them? And because not everybody is going to be needing treatment every day, but we need to be sure that out-of-pocket spending stops. It is not sustainable. But it brings me to an innovation that Sickle Cell Foundation Nigeria has brought this year, our 30th year. And I think it's like a gift to Nigeria. We've looked and seen that HMOs are not registering us to take care of patients with sickle cell. We're looking for a more sustainable way of ensuring that patients are cared for in terms of medication and treatment. And that is what we have called a wait list initiative, or waiting list initiative. So all over Nigeria, the reason in fact came about because people were asking that Sickle Cell Foundation Nigeria, you're just in Lagos, you're not in Akwa Ibom, you're not here. And we have to remind them we're not government, mind you, but we work with government. and encourage government to do what they should do. Okay, but we're not government. So the wait list is such that we're going to be populating a database. So anywhere you are in Nigeria, north, south, east, west, if you have a problem like the complications of sickle cell, like the chronic leg ulcers that fail to heal and you can't treat it, you cannot pay for it, or hip degeneration that requires hip replacement, we place you on the wait list and mobilize the private sector, oil companies, banks. Many of them want to engage, but they're not sure exactly how to engage. First, they need an entity that's transparent, like Sickle Cell Foundation Nigeria, but they also need to see numbers. What are we talking about in terms of who are we going to man? Are we going to treat 1,000 patients in a month? And so they put money to it. If you look at what happened during COVID, we mobilized the private sector and they jumped on board and worked with government to achieve this. So this wait list, we believe, is going to work. Already, Nigerians are registering, and there's a database that the media team is doing. So we want to be sure that anybody with sickle cell can get treatment without, they can't even afford it. They go around begging for money to pay for themselves. So the wait list should help.
Oh, Dr. Akinsete, thank you for sharing your insights and thank you for the amazing and incredible work you and your team at the Sickle Cell Foundation Nigeria are doing. And it's very clear that healthcare is very important, especially for those living with the illness. Again, many thanks for coming on.